This is one example of allostatic load. The nature of our environment can give rise to different kinds of stress. Suburbs, middle class environments have their own kinds of stress. And inner cities, poor neighborhood, has yet a different kinds of stress. And this will affect our sympathetic nervous system, our immune system, our hypothalamic pituitary adrenal axis or HPA axis, and our inflammatory responses, or the stress, the different kinds of stress we are exposed to given our environment, given our residence, can also affect our cardiovascular system. And this in turn affects our health, different dimensions of health. This affects our physical health, cognitive functioning, physical activity or limitations, mental health, and so on and so forth, or even disability. And here we will have some relevant examples pertaining to biomarkers and maybe allostatic load. Living or being born in poor neighborhoods affects the level of attachment between children and parents, and this level of attachment can happen even before the kid was born in the mother's womb through the placenta or something. The level of attachment. Sometimes babies are smart, we all know. They can sense the environment when they are still in the mother's womb. And this is going to affect whether they are going to turn out to be attached, securely attached, or insecurely attached. And all this in turn is going to affect people's stress level, like hormones or cortisol level, or living in a highly stressful environment can affect people's security. This in turn affects maybe the loss in hippocampus area. So these are the biomarkers. And the final outcomes would be compromised immune system, the loss of bone minerals. It also affects our memory. So, as you can see, the social class differences in health is also manifested in this example. They work through the different biomarkers in here, which ultimately affects their final health outcomes in terms of immune system, bone minerals, or even memory, cognitive health. And sometimes the different diseases are interrelated, sometimes through the biomarkers. Hypertension or hyperglycemia, they are due to different causes. Salt intake, sedentary, being overweight or being obese, alcohol use. And there are different causes of hyperglycemia. Too many carbs intake, not enough glucose or insulin, or you skip them. And infection, illness and stress. So think about this. Think about this part for a second. What causes excessive salt intake? Does that have something to do with a person's place of residence or socio-economic well-being or social class? What affects people's salt intake? And what affects sedentary behavior or physical inactivity? The lack of exercise, in layman's word. Does that have something to do with a person's education level, which is one proxy of social class? Maybe due to a given social class, social economic status, people are not aware about the importance of exercise It may directly or indirectly link to hypertension. And what causes overweight or obesity? Does that have something to do with social class, characteristics of neighborhood, accessibility or inaccessibility of healthy food stalls, the lack of transportation? Is that another manifestation of social class differences or socio-economic status differences, overweight and obesity? Who are more likely to be overweight, rich or poor people or middle class? Take a wild guess. Who? Poor, yeah. Maybe because of the different levels of health literacy. Maybe low educated folks, low income folks are more likely to be overweight and obese or underweight. It can be the reverse. And who are more likely to abuse alcohol? People who live in a certain environment, maybe insecurely attached families or whatnot. So, we can see the causes of hypertension are affected by the social conditions of a given place or the characteristics of a given neighborhood. So this is another manifestation of how social conditions are going to interact with biological factors to ultimately affect our health outcomes. The same thing for the causes of hyperglycemia. Are they going to affect the poor more, the middle class more, or the rich more? Too many carbs. Carbs are cheap, not too expensive. And who are more likely to consume more carbohydrates in their diets? People in a certain occupation, maybe blue collar work. And sometimes they correspond to people of a given educational level. So social class influence is also there. And like what Ali used to mention, insulin is expensive. So not everybody can afford insulin for their healthcare needs. Again, another manifestation of social class differences. And who are more likely to be infected? It depends on the neighborhood characteristics, right? And who are more likely to be ill? It's a no-brainer. And who are more likely to be stressed? Which group of people are more stressed? Poor people, middle class, or rich people? Who has more control over their life? Rich and middle class. So, social class differences are also manifested in the causes of hyperglycemia. Think for a second about the coupons, grocery coupons sometimes we get in the mailbox. The food on sale, food items or beverage on sale, are they healthy? Think for a second. We always get all these coupons, right? Are those healthy stuff? Sometimes they're 50% or 20% or 80%. Okay. Are those yogurt healthy or they are high in sugar? I don't know. Depends. So one fact sometimes is correct. The stuff on sale, the coupons we see, sometimes they are not healthy. And who are more inclined to purchase them is a no-brainer. So this is another manifestation of how social conditions, social class interacts with biomarkers to affect health outcomes. And having hypertension or hyperglycemia can lead to being diabetic. And what's the cause of diabetic mellitus? Family history. This has something to do with a person's neighborhood and social class. And another cause would be insulin. Not everybody can afford that. Or insulin production in the pancreas. And sometimes social class differences, neighborhood characteristics can also affect people's immune system. And it's a no-brainer. We talk about overweight and obesity or being sedentary. These all have social economic or social class implications. And sometimes being diabetic mellitus can also transfer into diabetic retinopathy. The disease, the form of the disease can change. I'm sure some of you know. And what's the cause of diabetic retinopathy? People neglect to monitor their blood sugar. Who are more likely to neglect? It's a no-brainer. Rich or poor or middle class. It's a no-brainer. And the duration of diabetes. Who are more in control of their diabetic situation? It's a no-brainer again. High blood pressure. Who has more knowledge in monitoring high blood pressure? Social class implications are manifested in there again. And sometimes people with diabetic retinopathy can, if they are not careful, develop what? Open-angle glaucoma. It eventually affects their eyesight, vision functioning. So the progression of these different diseases or health conditions talks about the different levels of health literacy or the different levels of healthcare access among people from different socio-economic statuses. Are we clear?